Well, the province is planning to give pharmacists more powers ahead of an expected surge in viral illnesses this fall. The government intends to allow pharmacists to prescribe influenza treatments to patients over a year old and give flu shots to babies. The Ministry of Health is asking for feedback on the new draft regulations from the Ontario College of Pharmacists. The college says this fall and winter could see a rise in COVID-19 flu and RSV cases similar to last year. Well, joining us now with more on this is Justin Bates, CEO of the Ontario Pharmacists Association. Long time no speak, Justin. It's good to be with you. Curious, what's your take on this? Do you think this is a good idea?
Well, it's a welcome step to prepare Ontarians for what we hope won't happen, but we need to prepare for it, the triple threat of both COVID, RSV season, so respiratory illnesses, and influenza. And really, it's about continuing to build on the momentum and the success of how we've safely implemented vaccinations in pharmacies and able to give Ontarians even more options and convenience. And if we can raise immunization rates and work with our colleagues in the public health units, nurses, and primary care, we'll be successful in terms of warding off some of the threats coming up this fall.
We know throughout the pandemic that it really highlighted a lot of cracks in our healthcare system, and part of what the Ford government has been trying to do is alleviate some of the stress on our hospitals by allowing pharmacists and pharmacies to, administer, simple things like vaccines and shots, amongst other issues, other treatments. Are you worried that the pharmacists could potentially be overwhelmed given the amount of demand that there is for things like RSV shots and potentially this new COVID-19 vaccine?
Oh, it's a great question and something that we take very seriously. We look at workforce capacity, and we have a number of initiatives underway to better support the profession and how we operationalize, implement these types of services. I think it's important to keep in mind that we have pharmacy technicians who are regulated that can also administer vaccinations. That's an important part of expanding the scope, in addition to the fact that we have implemented this over the last decade, starting in 2013 with flu shots, expanding to COVID, and now into travel vaccines and other vaccinations like RSV. So it's something we do very well. We have an appointment-based model in addition to the on-demand walk-in, and we've learned a lot about how to successfully and safely implement this to ensure that Ontarians have greater access to these types of services. And again, it's in partnership with other parts and other channels of distribution for vaccinations. So I think with the Team Ontario approach, pharmacists have demonstrated their ability to step up and provide solutions like this.
And Justin, several months ago when the province started talking about expanding the powers of pharmacists to allow them to administer more of these vaccines and treat other ailments, I had interviewed several pharmacists. I interviewed several people walking into the pharmacies, and it was widespread that the feedback was they love the idea. They love that the fact that they didn't have to go to a doctor, wait several hours, as oftentimes that happens in doctors' offices or hospitals, and the fact that they could just go to their local pharmacy to get what they needed. Yet there was a lot of pushback and a lot of resistance from opposition members. I'm just curious, are you surprised at all that there was that much pushback and criticism from the opposition when in reality, the overwhelming majority of the people that we've been speaking to were all in favor for it?
Yeah, I think not surprised. When anything is new, people tend to look at some of the negatives, potential risks. But keep in mind that this has been done in other provinces and other countries. We are still playing catch up when it comes to enabling scope for pharmacists and other healthcare providers. So we know that these things can be done and done safely and effectively. We have over 400,000 Ontarians that have already gone to a pharmacist to have an assessment and treatment for 13 minor ailments. And that speaks volumes about the public's acceptance. And it's about choice. It's not about taking away from primary care and giving to pharmacy. It's about adding capacity. And we need all healthcare providers to be practicing to the maximum of their expertise. And pharmacists are underutilized. We're healthcare hubs, and we're in the community everywhere, rural, remote, and urban. So it only makes sense to continue to build on this momentum and make sure that we have the same scope as other pharmacists do across the country.
We're expecting to have a press conference a little bit later this morning that is going to highlight some of the issues that we are continuing to see in our hospitals and some of the staffing shortages. And given that, there are several hospitals around the province that could potentially have a lack of staff, I'm guessing this just really highlights the importance that pharmacists can really do to alleviate some of these issues.
Absolutely. I mean, we did 13 million COVID shots. Annually, we do about 3 million flu shots. We think we should be doing all publicly funded vaccines, similar to other provinces that have enabled pharmacists. But at the end of the day, it really has to be about increasing capacity in our healthcare system, diverting emergency department visits. And if we can take low acuity, so more common ailments and things like vaccinations in the community and get people immunized, we'll avoid chronic conditions as well as hospitalizations. And that's really the goal here in terms of pharmacist involvement in the healthcare system.
Just keeping people healthy. Justin Bates, the CEO of the Ontario Pharmacists Association, we appreciate your time as always. Good to chat.